Hello, families, and welcome, and thank you for joining us today. Today, my colleagues and I are going to walk you through some simple tips to help you talk to children about COVID-19, or better known as the coronavirus. You are the first line of defense in reassuring your children during this time of uncertainty. Children will look to you and other family members for support and how to react to stressful situations. You know your child best, and let their questions be your guide. And it is okay if you don't have the answers, because we don't have all the answers. Use this opportunity to connect, to talk about the facts, to understand their feelings, and ask them what they're actually hearing out there. And always, always correct misinformation. Validate their feelings and encourage them to engage in activities to help them self-regulate. For example, exercise, meditation, yoga, arts and crafts, even the good old-fashioned board game. The team will talk about how to reduce children's anxiety and fears and help you negotiate our current situation with an emphasis on positivity and hope. Before we start, let me introduce the team. Dr. Judy Carson is a school, family, community partnership consultant. Dr. Stephanie Knutson is a school nursing and health education consultant. Mr. Scott Newgass is a licensed social worker and mental health and crisis management consultant. And I am Kim Traverso, licensed professional counselor, consultant for behavioral health and also social emotional learning. And I'm going to start with Stephanie Knutson.
Thank you, Kimberly. My name is Dr. Stephanie Knutson. As a result of COVID-19, children may be experiencing fears and anxieties about the changes in their normal routine, as well as fears and anxieties about themselves or their family members getting sick. Your children may feel quite stressed as they are trying to adjust to staying home with significantly less interactions with their peers. Parents, remember that just as adults experience and react to stress differently, so do children. Some of the physical symptoms may be complaints of frequent stomach aches or headaches. It is important to take into consideration children's developmental stages in this conversation. Children of all ages, but especially younger children, may not know that they are actually experiencing stress. As a result, stress can manifest itself through changes in behavior, such as acting irritable or moody, withdrawing from activities, clinging to you a little more, sleeping too much or too little, eating too much or too little. With teenagers, remember, spending time with and confiding in their peers is a normal part of growing up. Therefore, with social distancing, they may express anger or excessive hostility toward family members. This may very well indicate that your teenager is experiencing significant stress. While negative behavior is not always linked to excessive stress, negative changes in behavior are always a clear indication that something is wrong. Parents, you know your children best, so paying attention to these changes in behaviors and addressing them is key. For younger children, keep explanations short and simple. Reassure them by letting them know that the adults in their lives, you the parents, will take care of them, and at the same time, teaching them how to stay safe and healthy by practicing good hygiene habits such as effective hand washing. Children in early middle school tend to be more vocal in inquiring about the truth about their safety. This age group may need help with differentiating facts versus fiction. Talk to them about the efforts that are being done both locally as well as nationally to slow and stop the spread of COVID-19. With upper and high school students, In-depth conversations are valuable. Remember, refer them to safe and reliable resources such as the CDC. Be honest, accurate, and factual, and include them in decision-making about family plans. In general, an important key to assisting all children with fears or anxieties is to encourage them to talk about their thoughts, their feelings. Be a good listener, stay informed, and tell them the facts about things in a developmentally appropriate manner. Remember, parents, that children look to you for guidance on how to react to stressful events. Listen and then respond by teaching children positive preventive measures, talking with them about their fears, and giving them a sense of some control over their risk of infection. This can really help reduce their fears and anxieties. At this time, my colleague, Scott Newgass, will continue the conversation.
Hello. It's been a long couple of weeks, and it looks like many of us may be at home for a while longer. So take a deep breath and remember the instructions for oxygen masks on airlines. You have to take care of yourself first so that you can take care of others. That deep breath is not just to feed more oxygen into your brain, but also gives you momentary pause to process your feelings, your thoughts, and the sensations you're experiencing before doing anything else. The challenges we currently face become more difficult when we have to manage our own anxieties so that we can take care of our families and ourselves. Here are some steps you can take. Reassure your children that you are safe in your home. If they're nervous about this, remind them of the cleaning, the hand washing, and other safeguards being used. While physical and safety needs are in place for your children, social distancing still increases isolation and limits opportunity for young people to engage in the usual variety of events. Recognize that restrictions on mobility are even more difficult for children than for adults. Try facilitating time for youngsters to be outside while observing social distancing. Help your children to stay in touch with extended family and social connections by phone, email, text, or video conferencing. Get outside while being safe. Even if you don't leave your own yard, allow yourself the chance to move around outside and breathe some fresh air. Avoid arguments. Well, that's easier said than done. There are few issues worth a major argument when you still have many days of close contact ahead. Leave until later what can be postponed, and admit to yourself that long-standing disagreements are not likely to change anytime soon. As they say in the movie, let it go. Be solution-oriented. We are all learning new skills and ways to think about our circumstances. No doubt you and your children will make mistakes. Be forgiving. Work on solving the problem and not the person. Watch your family's diet. The combination of stress and inability to engage in many typical stress relievers often results in unhealthy eating habits. Schedule regular meals and snacks. Try not to eat while watching television, and use the time for family to come together. Watch out for time creep. No longer being able to rely on the usual time requirements contributes to a sense of disconnectedness and disorientation. Establish a schedule for activities and try to build structure into leisure time. Answer your children's questions, even when there are answers you would rather not share. When discussing upsetting news, be honest and straightforward about your own understanding of the events. Model how we discuss personal feelings. Avoid graphic details. Reframe upsetting perspectives or comments, or move to another subject. Provide explanations that make sense to your child. Consider nonverbal dynamics during the interaction. The rate, tempo, and volume of speech, posture, and activity levels, not only your child's, but your own as well. How are we reacting in these situations? Remain non-judgmental. Seek out the thoughts of your children. Be investigative. As we rethink how we remanage and realign our time and activities, try to avoid exposing your children and yourself to persistent news feeds. Breaking news often precedes meaningful details that would have any pertinence to you or your family. If you feel a need to watch, try to limit the news to once a day. Little genuine story development is likely to take place more rapidly than that. Take a deep breath. Things are serious. The virus can be deadly. Follow social distancing recommendations, wash your hands frequently, practice safe hygiene, follow any additional guidance from trusted authorities, and stay home if you can. Your family counts on you to stay healthy. Do that for them and for yourself. Take another deep breath. Hold it for a moment. Think about how you can help yourself. And now exhale slowly through your mouth. Now I'd like to pass you to my colleague, Dr. Judy Carson, who is going to expand further on some family activities and supports.
In a few short weeks, the coronavirus has drastically altered our daily lives and the connection between families and schools. Parents and teachers are being asked to take on new responsibilities with no time to prepare. A lot of parents are feeling overwhelmed with supervising their children and working from home or navigating shifts in their employment. We want to do the best we can right now for our children, but being good enough is okay. We have weeks, perhaps months of this to get through. We don't need to do everything. We just need to concentrate on what's important. And right now, that's people and relationships. There are a few suggestions that can make this time a little easier on parents and children. First, parents can't and don't need to be experts and have all the answers. Teachers are working very hard to make the shift to remote learning, and they're sending home new information and tools and finding many ways to communicate with students. As parents, the best thing we can do for our children with this change in their education is to be encouraging. Let them know that this is new for everyone and might be confusing at times, but we believe in them and we'll get through it. Along with encouragement, parents' expectations for their children make a big difference. One way to help children know what is expected of them is to set a daily schedule. It turns out that a predictable flow in the day is not only good for children, but it helps adults too. When the daily routine is predictable, it helps us cope with everything else that can seem very uncertain right now. There's lots of advice out there for daily routines, but take what works for you and your family and leave the rest. Trying to do a good job as a parent can definitely lead to information overload. Yes, we want our children to learn, but there's information coming at us from every direction. It can be a lot. Remember, doing simple things with children like cooking, reading, drawing, cleaning, talking, playing, it's all learning. If you can make it fun, even better. Having just said to avoid information overload, I want you to know that we have provided some ideas for fun, simple home learning activities on our website, and we'll tell you more about that in just a minute. Finally, one of our most important relationships as parents is with our children's teachers. Teachers are also under a great deal of stress right now. Many of them are parents too. Shifting from classroom teaching to remote learning is an enormous task. Many teachers are making regular contact with parents, but if you haven't heard from your child's teacher or if you have a concern, be sure to reach out to them. Parents and teachers are on the same team, and together we can help our children and we can get through this. Let me turn you back over to Kim, who's going to tell you more about resources to support you and your family.
Thank you, team. And thank you, parents, for joining us today. And if you need further information, our contact information is provided in the webinar slides. Additionally, we have posted a wealth of resources on the Connecticut State Department of Education website. The link to the webpage is on our resource slide. And remember, at any time you or your child are feeling stressed or overwhelmed, you can dial 2114 for assistance, and they are open 24/7. And remember what Commissioner Cardona says, we've got this.